I'm joined by Jennifer Weston, Director of Revenue Cycle Optimization for the University of Illinois Health. Jennifer is a panelist at our upcoming Denials Mitigation program, where she joins a session focused on denial management strategies. Jennifer, thanks so much for joining us.
Hi, Kate.
To kick things off, could you share a little bit about your professional background with us, specifically how you got your start in the healthcare industry?
So my start in the healthcare industry is an interesting one. I actually went to UIC for my undergraduate degree, and my sophomore year went to a job fair and ended up as a student accounting assistant in the patient accounts department for what was then called University of Illinois Medical Center at Chicago. Throughout my undergrad, I worked for the patient accounts department doing bad debt audit reviews, making sure we ticked off everything for Medicare and things of that sort. And then when I graduated, they offered me a position as resource and policy analyst. So for a couple years, I worked with the patient accounting department working on CMS contracting, doing MAC redeterminations. NPIs came out during that time, and so I led a group of people that enrolled every single provider in each hospital location with their own NPI. I left the healthcare industry for a couple years to go to law school. I do have my JD and I'm a licensed attorney, but decided to come back to healthcare after I finished that up, and returned back to UIC as an organization through their professional billing organization, Wolcott, Wood & Taylor. There I worked over the PB teams, so professional billing, worked with their AR team, cash posting, as director of business operations. So worked throughout each of the different areas. And then in my most recent roles, moved more towards process improvement and project management within revenue cycle. So I transitioned from Wolcott, Wood & Taylor back to UI Health proper, the hospital itself, in 2019, and since then have been focusing on revenue cycle optimization and process improvement, whether that being from our IT infrastructure to our people to our processes. And most of that has been, we recently went live, it's now been 3 years. We did go live with a conversion from using Cerner and various disparate systems for billing in each different area to Epic Enterprise back in September of 2020. So focus is on optimizing revenue cycle within Epic.
And outside of the optimization of revenue cycle using Epic, are there any other main priorities in your current role that you would share with the audience? You know, what else is on your radar at the moment?
So, being part of this panel that I'm going to be on, denials management. So one of the things that we are looking at optimizing is reducing our denials and putting together a robust denials management program. So outside of optimizing the use of Epic and preventing denials in general, and just making the revenue cycle system work cohesively together, it used to be in silos, and we're really trying to get it more. It's an integrated cross-functional team. So revenue cycle as a whole. But also in the last year and a half, I've started to focus on denials management. So really working with our revenue cycle and revenue cycle adjacent counterparts to reduce denials. So really making sure that there are forums for each of those cross-functional teams to be able to come together and work through issues they may be having, and then also denial prevention.
Well, we're really looking forward to having you on the panel. It sounds like you've got a lot to share with the group and to discuss with the other panelists. If there was one question or one area that you'd like to see addressed during the panel, you know, within the panelists or with the audience, is there any one thing that you would want to discuss?
You know, one of the main things that have really been on my mind is really working with our payer partners and using things such as IHA or MGMA to really work with our payer partners to reduce denials. It is on both sides. It's provider problems and it's payer problems. And if we could really work towards being partners together in reducing those denials, there's so much administrative burden that really increases the cost of healthcare, and that's what denial prevention is all about, is reducing that cost.
Absolutely, and I was just talking to one of the other panelists yesterday about what his core focus is, and he was literally just said working with payers, creating a collaborative relationship, really bringing the teams together is his biggest focus. So certainly that's going to be a great topic of conversation for the panel. And we really look forward to having you join the discussion in September and appreciate you coming on today to share a little bit about yourself with the group.
Oh, definitely. And I'm very excited to participate in the panel as well and see what else I can get out of that day.